The pill camera, more formally known as capsule endoscopy, is a marvel of modern biomedical technology. It's a non-invasive diagnostic tool that allows for the visualization of the gastrointestinal tract, particularly areas that are difficult to reach with traditional endoscopy methods. Technical aspects: the pill camera is a small capsule, about the size of a large vitamin pill, which contains a miniature camera, light source, power source, battery, and wireless transmitting capabilities. The camera is often a CMOS image sensor or IC-CMOS for lower power consumption and efficient image capture. The capsule is designed to be biocompatible and safe to pass through the human body, functioning. Once ingested, the pill camera travels through the digestive tract, propelled by natural peristalsis. As it moves, it takes thousands of high-resolution, color images of the mucosal lining. These images are transmitted in real time to an external recording device worn by the patient on a belt around the waist. The device stores the images for later analysis by a healthcare professional. The entire journey through the gastrointestinal tract takes about 8 hours, after which the pill camera is excreted naturally. Applications: the primary application of the pill camera is in the diagnosis and evaluation of various conditions within the gastrointestinal tract. This includes identifying sources of gastrointestinal bleeding. It's particularly useful when bleeding is suspected to be coming from the small intestine. Diagnosing inflammatory bowel diseases. IBD conditions like Crohn's disease and ulcerative colitis can be assessed through the images captured by the pill camera. Cancer diagnosis. Tumors and other abnormalities within the digestive tract can be detected. Celiac disease. It can be used to monitor the health of the small intestine in patients with celiac disease. Polyp detection. Familial syndromes that cause polyps in the small intestine can be screened for. Diagnostic follow-up. If traditional imaging tests are inconclusive, a pill camera can provide additional information. The pill camera has revolutionized the field of gastroenterology by providing a patient-friendly, less invasive method for examining the internal surfaces of the gastrointestinal tract. Its ability to reach and visualize the small intestine has made it an invaluable tool for diagnosing and managing gastrointestinal diseases. Its wireless transmission. The wireless transmission technology in a pill camera is a critical component that enables the real-time transfer of images from the capsule to an external receiver. Here's an in-depth look at how it functions. Wireless transmission mechanism. The pill camera uses radio frequency, RF, communication to wirelessly send the captured images. Once the images are taken by the camera inside the capsule, they are transmitted using a band of appropriate frequencies to ensure a stable and clear transmission. The RF signals are picked up by a receiver that the patient wears on their waist, which is connected to a recording device. Technology used. One of the state-of-the-art technologies for wireless transmission in pill cameras is based on the Medical Implant Communication Service, MICS, band. This band has an allowable channel bandwidth of only 300 kHz, which is suitable for the small amount of data transmitted by the pill camera. The MICS band is specifically reserved for medical devices, which helps to reduce interference from other electronic devices. Data handling. The images collected by the miniature camera are stored in a sequence and sent to the receiver in packets. These packets are then compiled into a video format that can be reviewed and analyzed by healthcare professionals. Proprietary software algorithms are used to enable smarter video compilation that is efficient and tailored to the diagnostic needs. Advantages. The wireless transmission technology in pill cameras offers several advantages. Non-invasive. There's no need for wires or cables passing through the body, making the procedure more comfortable for the patient. Real-time monitoring. Physicians can monitor the gastrointestinal tract in real time, which can be crucial for timely diagnosis. Safety. The use of the MICS band ensures minimal interference and maximizes patient safety. Overall, the wireless transmission technology of the pill camera represents a significant advancement in diagnostic medical tools, allowing for greater patient comfort and providing detailed insights into the gastrointestinal tract that were previously difficult to obtain. The way pill camera handling power. The pill camera is ingeniously designed to be self-contained, with its own power source to handle the energy requirements of capturing and transmitting images throughout its journey in the gastrointestinal tract. Power source. The primary power source for most pill cameras is a set of button-shaped silver oxide batteries. These batteries are chosen for their small size, which allows them to fit within the compact dimensions of the capsule. They are typically positioned in a row behind the CMOS image sensor within the capsule. Battery life. The batteries are designed to last for the duration of the capsule's journey, which is approximately 8 hours. This duration is sufficient for the pill camera to travel through the entire length of the gastrointestinal tract and capture the necessary images. Energy efficiency. To maximize the battery life, the pill camera employs various energy-saving strategies. Adaptive frame rate technology. The camera adjusts the image capture rate from 2 to 6 frames per second depending on the speed of movement through the digestive tract. This ensures that more pictures are taken in areas of interest while conserving energy when less activity is detected. LED lights. The capsule uses tiny LED lights for illumination, which are energy efficient and provide enough light to capture clear images of the digestive tract lining. Safety and disposal. After the pill camera completes its journey and is excreted, the batteries are safely contained within the capsule. Since the batteries are small and used in a single-use device, they do not pose a significant environmental hazard. However, proper disposal according to local regulations is recommended to minimize any environmental impact. Overall, the power management of the pill camera is a critical aspect that ensures it functions effectively throughout the diagnostic procedure, providing a reliable and patient-friendly method for gastrointestinal examination. The case if the battery runs out during a procedure. If the battery of a pill camera runs out during a procedure, it typically means that the device will stop capturing and transmitting images. However, this is a rare occurrence because the batteries are designed to last longer than the average transit time through the gastrointestinal tract. In the event that the battery does run out before the procedure is complete, here are the possible scenarios and actions. Incomplete diagnostic information. If the battery fails before the capsule has passed through the entire digestive system, the images obtained may be incomplete. This could necessitate a repeat of the procedure or the use of alternative diagnostic methods. Natural excretion. Regardless of whether the battery is functioning, the pill camera is designed to be excreted naturally from the body within a day or two. If the battery is still running as it comes out, there might be a flashing light, but if the battery is dead, there will be no light, making it harder to spot. Safety measures. Capsule endoscopy is a safe procedure with a very low risk of complications. In case of a battery failure, the capsule itself does not pose any harm and will be excreted naturally. Monitoring and follow-up. During the procedure, patients are monitored, and if any issues arise, such as a suspected battery failure, healthcare providers can take appropriate steps, including scheduling a follow-up appointment or additional tests if necessary. It's important to note that battery failure during a capsule endoscopy is an uncommon complication due to the rigorous testing and design of these medical devices to ensure they operate effectively throughout the diagnostic process. Details about capsule endoscopy safety. Capsule endoscopy is widely regarded as a safe and minimally invasive procedure. Here are some key points regarding its safety. General safety. Non-invasive. Unlike traditional endoscopy, capsule endoscopy does not require sedation or anesthesia, making it a safer option for many patients. No external equipment. Since the procedure involves swallowing a pill-sized camera, there's no need for external tubes or instruments that could potentially cause discomfort or injury. Risks. Capsule retention. The primary risk associated with capsule endoscopy is the capsule becoming lodged in the digestive tract. This is known as capsule retention. However, this risk is quite small and is typically associated with conditions that cause narrowing, strictures, in the digestive tract, such as Crohn's disease or previous surgeries. Symptoms of capsule retention. If a capsule does get stuck, symptoms might include abdominal pain, nausea, or vomiting. In such cases, further medical intervention, including potential surgery, may be required to remove the capsule. Precautionary measures. Pre-procedure screening. To minimize the risk of capsule retention, patients may undergo a screening process, which can include imaging tests like a CT scan to identify any strictures or narrow areas in the digestive tract before the procedure. Patient monitoring. Patients are monitored for any signs of discomfort or complications during and after the procedure. If any issues are suspected, healthcare providers can take immediate action. Post-procedure. Natural excretion. The capsule is designed to be excreted naturally within 24 to 72 hours after ingestion. Patients are usually advised to check their stools to ensure the capsule has passed. Follow-up. After the procedure, a follow-up appointment is typically scheduled to review the images captured by the capsule and to confirm that the capsule has been excreted. Overall, Capsule endoscopy is a valuable diagnostic tool with a strong safety profile, offering detailed insights into the gastrointestinal tract with minimal risk to the patient.